Hi, my name is Leah Crown. I'm the Director of Health and Human Services for the City of Meriden. This is our second video answering questions from our residents that you have put on our social media regarding coronavirus or COVID-19. So thank you all for your questions. As you are aware, COVID-19 is a very rapidly changing situation. The answers to your questions are based on current CDC guidance and the Connecticut Governor's executive orders as of March 31st, 2020. So we received 7 questions. Our first is, why are library staff still reporting to work? So I called the interim director of the Meriden Public Library to answer this question. The library is still offering online services, is providing temporary library cards to residents to access these online services. They're holding virtual story hours for children on their social media. They're answering phones and keeping patrons up to date of activities by their social media. They're also ordering and processing materials as they come into the library. Our second question is, how many confirmed positive COVID-19 cases are there in Meriden? So as of today, March 31st, we have 21 confirmed cases in Meriden. Case counts are updated by the state daily after 4 p.m. and can be viewed on the State of Connecticut website. We will also be posting them to our Facebook page each evening after the state website is updated. We believe that there are many more individuals ill with the virus in Meriden who have not been tested and are caring for their symptoms at home. We know that there is community transmission, so I urge you to please follow the recommended public health prevention practices that we've been preaching for a very long time. They're simple and they work. These include measures such as social distancing, staying home if you're sick, covering your cough, washing your hands often, and cleaning and disinfecting surfaces that are touched often. The third question is, what are the guidelines or rules we should be following when going to the grocery store? So again, while we urge everyone to practice social distancing, unfortunately we know that that will not always be the case. So if you go to a store and there are a lot of people there and you are just not comfortable with the crowd size, you may want to leave and visit at another time. The governor has emphasized that businesses and entities that provide essential services, which include stores that sell food, they should implement rules that help facilitate the social distancing of at least 6 feet. Our next question was, if MidState cannot handle the situation, what is the sister facility? Does Meriden or Connecticut have a system in place for when, if local hospitals become overwhelmed? And I can say yes, we do have a plan in place. There's been many discussions on this and daily discussions. The latest update from MidState is they have enough ventilators and beds to handle medical surge, and medical surge beds are being set up. They assured me that they are prepared for a surge in cases if needed. MidState is part of Hartford Healthcare that has many locations throughout Connecticut. Our fifth question is, should asymptomatic people be quarantined if positive? So if someone tests positive for COVID-19, we, the local health department, will become aware of it as this is now a reportable disease in the state of Connecticut. We will contact the ill person and provide them guidance on isolation and caring for their symptoms while at home. We will also provide guidance to their contacts of the case if they were in close contact with the person while they were sick. This may mean that those without symptoms will be quarantined for up to 14 days, depending on their contact. We follow CDC guidance for this protocol. The next question is, when can a symptomatic person be tested to prevent transmission? So if someone has symptoms related to COVID-19, and these include fever, cough, shortness of breath, they need to contact their doctor about a test. They can also contact the Hartford Healthcare COVID-19 hotline toll-free at 1-833-621-0600 to inquire about receiving a test. It is up to a medical professional if someone will receive a test. If a test is not given, the individual will be given guidance on how to care for their illness at home. This guidance is also on the CDC website. The last question that we received is, can you get COVID-19 from mail? The person that asked this question says, I handle a lot of return mail at my workplace. So the CDC, the World Health Organization, and the Surgeon General have indicated that there is currently no evidence of COVID-19 being spread through the mail. Specifically, according to the World Health Organization, the likelihood of an infected person contaminating commercial goods is low, and the risk of catching the virus that causes COVID-19 from a package that has been moved, traveled, or been exposed to different conditions and temperature is also low. And according to the CDC, in general, because of poor survivability of these coronaviruses on surfaces, there is likely very low risk of spread from products or packaging that are shipped over a period of days or weeks at ambient temperatures, which is room temperature. So those were all the questions that we received. We hope to do this on a weekly basis. I really thank you for your questions. I know that this is a very unsettling time for people. Please remember to take a moment for yourself, turn off the news, call or FaceTime friends and family to see how they're doing. If residents have questions, please reach out. Info line 211 is also a great resource, as well as the CDC website. I can assure you that your local health department is working very hard on monitoring the health status of our community and keeping up to speed on guidance that we can then pass along to our community. Thank you, and be well.